Childbirth should be one of the most happy times in a woman's life. As a mother, myself, I have never lost awe of childbirth. You would think with all the medical advances in this country that the risk for pregnant people should be going down. But that's not what's happening. I want to show it to you. This is a chart from the CDC, and this is showing us the rise in the proportion of women that are dying from pregnancy and childbirth. And these 3 years we're seeing here, 2018, 19, and 20, this is before the pandemic. And you see the rate of maternal mortality going up sharply. Now, in 2021, it's 32. Twice as many women are dying from pregnancy and childbirth today than they were 20 years ago. If you look at how we stack up against our neighbors, this is the deaths of pregnant women in our country compared to all of our neighbors. The proportion of Black moms who die from pregnancy and childbirth is 3 times as high as that of white women.
So why is this happening? We know there are inequities in healthcare, and factors like lack of prenatal care can lead to complications like low birth weight, preterm delivery. And with these statistics, more and more women of color are sounding the alarm that they're not being heard or believed when they bring up their issues with their doctors.
Yeah, we have to sound the alarm. 53% of what we're calling maternal deaths are actually occurring between 7 days and 1 year postpartum.
Wow.
The American College of OBGYN in the past few years have come forward with this new concept and has provided us with guidelines of what to do during what they're calling the fourth trimester. It used to be that you would have your kid, and then 6 to 8 weeks later, you'd get a quick visit with your doctor and see you later in a year. And what they're finding, to your point about when the majority of these deaths are occurring, is that we need to be more vigilant during this 4th trimester, those 12 weeks after someone gives birth. And it could be very few visits because you are low risk, but for someone who's high risk, they need to be coming in more frequently.
If you think about the difference in what we're doing in the US and our neighbors, where their maternal mortality rates are so much lower, one of the biggest differences is what they do postpartum, that they don't just say goodbye from the hospital. After childbirth is this sacred time to wrap around and take care of the new mom and her baby, and also make sure that she's okay.
So there's cultural differences in how these other countries who do better approach the mom. Then there's institutional differences, right?
The midwife, after you have your baby, someone comes in to take care of the mom and the baby.
Yes.
They're checking in.
Yes.
Well, and it also doesn't have to be a physician or a midwife.
No.
It could be a nurse,
Correct.
a social worker,
Yes.
a community health worker. Because look, what are the things we need to check for? Blood pressure check for preeclampsia, a wound check for C-section, that the baby's nursing well and growing, and the mom's mental health, right? A quarter of these deaths are now in the US due to mental health problems. And so any one of those people coming into the home in a regular time period could check on all those things.
One of the reasons we're all sitting here at this table is to provide a safe space for discussions about women's health. And when we come back, you will meet a mother who got the news her daughter died just weeks after giving birth, after she repeatedly asked her doctors for help. Now, she's a warrior in her daughter's name to save the lives of other women.